What is human metapneumovirus hMPV?
Human metapneumovirus hMPV is a virus that usually causes symptoms similar to the common cold. It often causes upper respiratory infections, but it can sometimes cause lower respiratory infections like pneumonia, asthma flare-ups, or make chronic obstructive pulmonary disease (COPD) worse. hMPV infections are more common in the winter and early spring.
Is human metapneumovirus just a cold?
Human metapneumovirus most often causes symptoms similar to a cold, but some people can get very sick. You're more likely to get severely sick the first time you get hMPV, which is why young kids have a greater risk for serious illness. You get some protection immunity from your first infection, and then are more likely to have mild, cold-like symptoms if you get another hMPV infection.
How common is human metapneumovirus?
Researchers estimate that about 10% to 12% of respiratory illnesses in children are caused by hMPV. Most cases are mild, but about 5% to 16% of children will develop a lower respiratory tract infection like pneumonia.
Is human metapneumovirus the same as RSV?
It's not the same, but human metapneumovirus is similar to RSV respiratory syncytial virus. It's part of the same genus or scientific grouping as RSV pneumovirus and can cause similar symptoms.
What are the symptoms of human metapneumovirus?
Cough, fever, runny or stuffy nose, sore throat, wheezing, shortness of breath, dyspnea, rash.
What causes a human metapneumovirus infection?
A virus, a small germ that uses your cells to make more copies of itself, causes hMPV. It's part of the same group of viruses that cause RSV, measles, and mumps.
How is human metapneumovirus transmitted?
hMPV spreads through direct contact with someone who has it, or from touching things contaminated with the virus. For instance, coughing and sneezing, shaking hands, hugging or kissing, touching surfaces or objects like phones, door handles, keyboards, or toys.
What are the risk factors for human metapneumovirus?
Anyone can get hMPV, but you're at a higher risk for severe illness if you are younger than 5, especially premature infants, or older than 65, have a weakened immune system from conditions like HIV, cancer, or autoimmune disorders, or from medications that suppress your immune system, have asthma or COPD.
How is human metapneumovirus diagnosed?
Healthcare providers usually diagnose hMPV based on your symptoms and health history. They might use a soft-tipped stick swab to get a dot sample from your nose or throat. A lab tests the sample for viruses and other infections. Keep in mind that you probably won't be tested for hMPV unless you have serious symptoms.
How is human metapneumovirus treated?
There aren't any antiviral medications that treat human metapneumovirus. Most people can manage their symptoms at home until they feel better.
Can you prevent a human metapneumovirus infection?
You can reduce your risk of getting hMPV and other infectious diseases by washing your hands often with soap and water. If you aren't able to use soap and water, use an alcohol-based hand assay (NITIZER). Cover your nose and mouth with your elbow, not your bare hand, when you sneeze or cough. Avoid being around other people when you or they are sick with a cold or other contagious diseases.